Hello, and thank you so much for tuning into Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. Today, we're going to talk about osteoporosis. You might think that it's, maybe your grandmother's disease. You'd be wrong. Women as young as 50 years old can be affected. In fact, a fracture or any type of bone break can be the first clue that a postmenopausal woman has this silent disease. Now, here in studio to help us clarify some of the fractured truths surrounding menopause and osteoporosis is Dr. Tara Allmen. She's a gynecologist and nationally certified menopause practitioner. Welcome to the Health Professional Radio program, Doctor.
Thanks so much for having me, Neal.
Thanks for joining us and taking the time. Now, I've heard of osteoporosis. I'm sure all of us have heard of osteoporosis. Our listeners are mainly healthcare professionals such as yourself. But just for clarification, very simply, what exactly is osteoporosis and why is it that postmenopausal women seem to be at a higher risk?
Well, osteoporosis is actually an epidemic in this country. It's thinning of the bones that puts women especially at risk for bone fracture. And postmenopausal women are particularly at risk because they're no longer making estrogen, and estrogen is very bone protective. So once women no longer make estrogen, their bones, they start losing bone, and all postmenopausal women are at risk for osteoporosis. I heard you say earlier that, women think this is a disease of our grandmothers and our mothers, but it's really a disease of all postmenopausal women.
So what causes osteoporosis?
Well, at some point, our ovaries get to retire. That's what menopause means. So ovaries have been working very hard for us. I like to say to women, we should thank them for their service. But at some point, the average age of menopause is 51, and that means that ovaries are all pooped out and are no longer producing estrogen. And that is when the protection for our bone health goes away, and we are now going to start, so many of us, losing bone. That is a critical piece of information for all postmenopausal women, especially the 50-somethings, to really understand.
I mentioned that this is a silent type of disease, and also that a bone break, a fracture, might be your first indication that you have a problem. What are some of the other symptoms of osteoporosis that aren't as glaring?
Well, you're absolutely right. It's called a silent disease because women don't know that they have it until they fracture a bone. But women will start to lose height, right? So you'll see women getting shorter, which is why it's so important to get your height done every year at your annual visit. And you'll see women hunching over. That's all bone loss from the spine. But mostly it is a silent disease until you fracture a bone.
How often do you find this condition in women, say, in their mid to upper 40s or younger, maybe in their early 40s?
Well, osteoporosis is really not a disease of younger women for the most part. So women are at risk if they're thin, if they're smokers, if they have a parent who has osteoporosis who's fractured a bone. But mostly women are protected by the estrogen that they make. And so we're making estrogen in our 20s and 30s and 40s. So you really don't see the disease osteoporosis in this younger group of women. Where it really becomes important is when women go through menopause, when their ovaries stop making estrogen. So for the most part, you start seeing the disease osteoporosis for women in their 50s, 60s, and beyond.
Are there any preventive measures that a woman can take in her 30s or 40s to cut down or maybe even prevent osteoporosis or this bone loss? Maybe supplements or anything like that? Is there something that exists?
Well, all young women, all women absolutely need to eat a bone-healthy diet, and that means foods that are rich in calcium and vitamin D fortified. And women have to stop smoking or never start in the first place, and we have to limit alcohol consumption. And as I said, if you happen to have a gene for osteoporosis, you'll know that if your grandmother or mother has the disease, you are more likely to get the disease down the line. So when you're a younger woman, you want to exercise regularly, you want to do strength training, you want to eat a bone-healthy diet, and very importantly, you don't want to fall down. That's good advice for all women. Don't fall down, because if you fall down, you have a chance of fracturing a bone.
Is there any place that we can go online and learn some more about osteoporosis and how maybe to prevent the onset or at least slow it down?
Yes, the Fractured Truth campaign has a great website called fracturedtruths.com. I like that website because they have videos that really help explain the disease and the risk factors. And there's also a doctor discussion guide that women can learn from to bring this conversation to their own healthcare professional.
How are the treatments for osteoporosis as far as being cost effective to the consumer?
Well, I guess like with anything, let's not even get the disease. Let's avoid the whole conversation altogether, because being a person who has to live with osteoporosis and take medicine, well, that is, your whole life will be affected. So I think the most important thing that your listeners can do is get an education about the disease before they are at risk for the disease. And we're really talking again about your postmenopausal group, your 50-somethings. This is really the time to get started with research on osteoporosis.
Well, it's been a pleasure. Some great information, very informative. I thank you for coming in and talking with us today. Dr. Tara Allmen, gynecologist and nationally certified menopause practitioner. More information is available at www.fracturedtruths.com. Thank you so much for coming in today, Doctor.
Thanks, Neal.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au. Also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.